with the next talk as he is ready. Thank you, sir. Thank you very much.
Good morning, everyone. I'd like to thank the scientific committee for giving me this opportunity today. So today we'll just discuss something that's not very clinical, but a little paraclinical, which is cataract workflow. As cataract surgeons, every patient who's coming in for surgery, we have to work them up. There's a process that they have to go through. Some of us who do more surgeries, this is something very relevant. So let's just discuss what all technologies we have available today. Financial disclosure, I am a consultant for Carl Zeiss Meditech. So today when we have a patient coming in, the conventional workflow that we follow is that we'll first do a clinical examination, we'll perform biometry for this patient, the patient will undergo counseling where they're explained about surgery, the different options that are available, then probably the patient will come back to you with more questions, you'll discuss those options, probably finalize one, then you'll ask for new biometry printouts so that you can select the appropriate lens power. You might want to do some online calculations also to double check. Then you will find out about the availability of the IOL power in your stock or with the company. Then you'll go ahead, schedule the surgery for this patient. Then you will go ahead on the day of surgery, retrieve all the relevant data that is required, confirm everything on the day of surgery, do a timeout, confirm the lens power that is available. And by the time this whole process is done, we're just so relieved the surgery is done that we rarely ever even bother to do anything with the post-op data that we're collecting. So, there's a lot of redundancy in this whole process. There is a lot of back and forth for the patient, for your own staff. You'll get repeated printouts of the biometry. If the patient decides to change anything, you'll have to do calculations over and over again. And most importantly, there's a significant chance of errors. Some studies have shown that in medicine, transcription errors alone can be almost 5%. So, you can end up with IOL surprises. And sometimes when we have a refractive surprise after surgery, we try to find out all the different causes, but we might never pick up that it was actually just a data entry while calculating the power. And again, when we are trying to use these newer online calculations that are available, because we're entering the data again and again in different places, the chances of these errors will only increase. So, we have these digital operating tools that are available to us. So with machines such as a good biometer, we are able to capture the data we need. With EHRs and with solutions that are provided, for example, by Zeiss, which is the EQ Workplace, we are able to process this data. Then we'll have apps which can actually help us counsel the patient, educate the patient at the convenience of their home, on the convenience of their phone when they're in their waiting area. You can then process that data and then utilize it in something such as, markerless toric surgery. When you talk about EQ, the best part about technology is also that everything is relatively seamless. So this data that is available, since it's not a hard copy that is present somewhere in your office, it's available everywhere. It can be available on any device that you're using. You don't have to necessarily be at the office. You can do all your calculations, all your planning sitting at home, so that it saves time for you when you're actually in the OR. The other great thing is that with all this data readily available for researchers, it makes things much more efficient and effective, and it's very convenient to pick up data for when you have to make a presentation also. So one thing that we might be relatively more familiar with is the whole markerless toric surgery platforms that we have available, for example, Callisto. So if we talk about, when we normally want to plan a toric IOL, we'll have to do the same steps: clinical examination, keratometry, A-scan, calculate the IOL power, then mark the references in the OR, and then perform the surgery. But if you move to a digital tool, markerless toric surgery, we can reduce that down to just 3 steps, which clearly saves a lot of time. But studies have actually shown that even beyond this, if you just repeat the same process with something such as EQ Workplace, which is a whole cataract flow solution, you'll actually save a further 4 minutes per case. So the NHS also did a study on never events, which are mistakes that happen because of, again, data entry or operating on the wrong eye. And the reasons that they found was they can be just poor communication between you and the patient. They can be poor management of your records that you're maintaining. You did not check the data properly before planning the surgery. Again, planning the patient, marking the patient was not done accurately. Within the OR, there can be poor communication between different staff members, leading to errors. IOLs, maybe someone picked up the wrong IOL. And if you just don't, even if you impose protocols, it's very difficult to make sure everybody is following them. So there are a lot of chances of errors that can happen and which can affect the patient significantly. So again, when we talk about these digital cataract workflow solutions, we can really help avoid a lot of those errors. We are talking about an OR or a solution where we have a patient come in, all the work examination is done on a biometer, that data comes to you seamlessly in your office, you look at it, you talk to the patient, whatever IL they have, you have the data readily available over there. Anything you want to change or alter in the data, you can do that. Now you don't have to keep going back and forth between machine to find out that, oh, are you suitable for a premium presbyopia correcting IOL or not. All that information is readily available to you. You don't have to re-enter the information and again and again. You can have an app which will help. You discuss with the patient that, okay, this is the IOL that we are considering. The patient opens up the app. The patient can read all about the IOL, the different negatives, the different positives, and make a much more educated decision. And then all this data is automatically sent to your OR. You can visualize this when you're operating. You can actually now control the steps of cataract surgery, everything, including digital marking, right from your phaco machine. You don't even have to have someone do the marking or the calibration on the microscope. It really helps streamline everything, save you a lot of time in the OR. With new apps such as iGuide, again by Zeiss, you can have patients take well-informed decisions about what their options are. You can give them checklists, so when they come in for the day of surgery, they're better prepared. They know what they have to go in for. They can have reminders for their drops and post-op visits after the surgery. And we're hearing a lot about AI, and ChatGPT has really come into the commonplace. So everybody's talking about it. We do have formulas that have been available now for a few years, which are based on machine learning. But at the AACRS this time, there was actually some data presented which showed that the new formulas, which are incorporated into the new cataract workflow solution, which is Veracity by Zeiss, it is actually more accurate than any other formula that is available right now. That is the advantage of something which captures data end to end. That it is capturing data seamlessly. It is able to utilize that data, so it's not dependent on you uploading that data. Some of the limitations that will be there obviously are cost, but again, since it's cataract surgery, the economies of scale kick in because you'll do a lot of these, so you will end up using this quite a bit. There is vulnerability with any technology, any server downtime, you'll be trapped. And yes.
You need to wind up.
Last slide. And obviously, you'll be confined to one ecosystem when you use this. Just same thing summary, that you save time, reduce errors, you better educate your patients, and you get to analyze more data. Thank you.